Hi again. My name is Resha Erheim. I'm a clinical counselor and a couples therapist working at Wise Mind Center in Dubai. Today, we're going to briefly talk about postpartum depression. It's quite a taboo subject. Postpartum depression is the depression that a new mom faces after giving birth or after becoming a mother. Now, there's a distinction and a difference between what we call baby blues and postpartum depression. Baby blues is very common. Up to about 80% of new moms experience it. Baby blues can start from the first day you give birth up to a few days after, and it can last up to 2 weeks in length. Baby blues symptoms could be things that you've experienced when you've become mothers, like mood swings, anxiety, irritability, sadness, maybe crying spells, feeling overwhelmed, having your concentration reduced, trouble maybe sleeping, or even appetite problems. Now, these symptoms are usually quite normal and they subside within a few weeks. However, a more severe version can last for up to a few months or up to a year even after giving birth, and it can even start before giving birth, and this is called postpartum depression. So postpartum depression, you can think about it as the typical depression, but that happens after a new mom becomes, after a woman becomes a new mother. Postpartum depression signs and symptoms could fall under similar symptoms of baby blues, but more intense and extreme. Things like depressed mood or severe mood swings, excessive crying, difficulty bonding with the baby or doing your responsibilities or even caring for the child, extreme loss of appetite, or even emotional eating and eating too much. An inability to sleep, having insomnia or oversleeping can become an issue. Reduced interest in pleasure or in activities, sense of irritability and being easily frustrated and quick to anger, maybe even fears that you're not good enough as a mother. A sense of hopelessness can occur. Also difficulty bonding with or staying in touch with your friends and family. So sometimes mothers withdraw, especially when first-time moms, when they don't know yet how to balance their time well. And in more extreme cases, it can involve thoughts of harming yourself or the baby, severe anxiety and panic attacks, or even a diminished ability to think clearly, make plans, or feelings of hopelessness. It's important to know that this is a mental health disorder. It is not your fault and it's not a weakness. It really is about a chemical imbalance in the brain, and it can involve also genetic factors. So if your mother or sister or women in your family have had postpartum depression, there's a higher chance that you too might suffer from it. So it's important to seek treatment and to speak to a professional, whether it's a psychiatrist for medication management or to even speak to a psychologist for an assessment to see if a referral is needed. Getting support from family and friends is also really important. This is such a common experience that many mothers don't talk about, but also getting support from the community. There's a lot of online groups, forums that you can join that help support you. Remember that you're not alone in this, and this is not something you should get through or go through alone, especially if it's postpartum depression or there is a history of mental health issues in the family, or especially if you've had personally a history with depression previous to becoming a mom. So please talk to a professional, seek help, and you will get through this.